Good afternoon to all admirable women who are with us tonight in this professional gathering of Align, in which we have the honor of listening to just some of the female branch of our company. There are people who make this a special day in terms of celebration, like the Day of Love, the Day of Mother, or the International Day of Women. Of course, sometimes when we go back to the origin of these special days, we can fill our hearts with joy and pride and understand why of their existence. The International Day of Women, which in the beginning of the 20th century started in Denmark, was called the International Day of the Working Women. And it was during the incursion of women in the professional world. Today, we are part of the gender that for many years and that even today are and have been underestimated in many scopes, especially the labor one. So we are in a very interesting moment in our history. Today, it's not about a very celebration. It's just not just about a celebration. We want to celebrate a special day and create the awareness of the importance of love. It fills my heart with pride as a woman and as a professional to have the honor of presenting a group of doctors who are part of the Align family, who are not just going to bring us to case of great success in their offices, but also that are going to tell us about their development as integral women, because this is our pathway to be integral women, professional women who follow our paths, our professional paths, and our labor goals. So, without any further ado, to me, it is an honor to be here and share with Dr. Victoria Charres, followed by Dr. Cecilia De Banco and Dr. Celia Bautista and Dr. Gabriela Aparicio. Please, questions can be asked through the Q&A, preferably writing the name of the doctor to whom you're asking the question. From Bogota, Colombia, Dr. Victoria, the floor is yours. Well, hello, good afternoon, everyone. It is a pleasure, a great honor to be with you, sharing this chat with you of amazing doctors who represent. Today, we have the opportunity of presenting a case that goes straight towards this information that is in your screen. Transforming Smile Changes Lives. And so as we are going to share clinical case that is in the global gallery, if you have the option of scanning, you can, because so that you can have more details of the case if that is your interest. We are talking about a woman, beautiful woman, symmetric woman who comes to the office telling me that she doesn't feel comfortable with her smile, that she doesn't like her teeth, of the front teeth, but that at the same token, she's afraid of changing her face and her facial expressions. But if we notice clearly, her smile is a shy one, is a smile that doesn't want to show, that hides something, that doesn't make her feel comfortable. We see that there is also, we can recognize a clear whitening of the tooth, some very interesting torque in the back part, especially on the canines, followed by some arches that are well formed that we could say that they have some spacing as well as a lack of a molar, number 36. It's a class 2, dental class 2, associated with a good malocclusion. In other words, a deep bite that is very important, which is one of the problems that we have to treat in this particular case. So basically, we collaborate what we see. In other words, an extrusion that is marked in the lower teeth that allows us this level of premolar and the incisives, and also we can see lower part in the back teeth. As we analyze in profile, we see a client class 1 to the limit, we could say, but some important inclination of these incisives, which collaborates with the formation of this class of deep bite. And here we have a part of our digital flow, all of the scanner with iTero. And why do I bring it? We collaborate all of the information that is in the picture, but part of what we see is that in this scan, the patient has the molar in the mouth. This number 36 in the picture, it was not there, but here I show you that it is. So when you're treating your patients in a very disciplinary fashion, you can keep a conversation or a close contact with all of those experts that related with in any way with the case, to avoid this kind of situation in which the rehabilitator makes the implant and almost, but the implant didn't adapt well, but I was lucky enough to see and make the correction. But this is why I say that it's important to have a communication with all of the doctors. As we see in these tools that we have in iTero, we can have some strong contact on the level of the back teeth as well as in the front teeth. As a general diagnosis, we can say that it is a patient with a profile, but her malocclusion class 2 associated with a deep bite, we can say about 80%, and an occlusion, an anterior plan, which is the reason why the patient comes to the office, which we say our main objective is to be fulfilled here. Taking into account all of the aspects that can generate a deep bite, we can say in some occasions, one aspect or a group of these aspects, we can see that there is an inclination in the inferior teeth. We can also see that there is also a very speed curve and also a horizontal skeletal scheme. But when I plan my deep bite treatment, I have to take into account a lot of aspects, such as the line, this line smile. To me, that's the most important when I have to decide what I'm going to treat and how I'm going to treat. The facial type, the number of teeth that I have to straight up. These amount as well as the type of intrusion. This allows me to know the kind of anchoring so that I can do the extrusion of this lower teeth. Also, I need to have to take into account, because of the patient's standard, if it's necessary to remove end of the lower end of the back teeth or the upper teeth, and also to have to account the inclination that these incisives have to create our protocol. So taking into account the diagnosis and all of our limitations and defects, we can define that the plan, as far as the objectives go, they will have to correct the malposition, expand the upper arc, especially on the level of the canines, with the objective of recreating space so that the blockage can expand. Also, improve the overbite and level the back occlusal. So this is how it was proposed in the following movement to correct this malocclusion: expansion, especially on the canine level, PIR protocol that emphasizes on retroinclination, intrusion, and proclination with a level of the curve with the intrusion in the back incisives. According to the movements that we can create to the conversion of these deep bites in this particular case, we can say that it is a working plan that is intermediate, of an intermediate complexity, because the management, the main management of the case, we are going to do with the intrusion of the lower incisives, of the back incisives. With that, we count on many smart forces or resources that are going to facilitate the correction of this small occlusion. Among them, we have these power readers or pressure points that are going to help me with the pro-inclination and helping the torque, especially of the superior teeth, lower upper teeth. We also have pressure areas on the level of the lower incisives that are going to help me with the intrusion of the force in the octudinal axis to produce this intrusion that I need so much. And as well as all of this will be supported by the bite ramps that allow me to, in addition to articulating the two arches to have a better leveling of the speed curve, it also helps me to support and pre-direct on the incisive level. In addition, we count on the optimized attachments of deep bites on the premolar level that can also be used to help level the plan or to serve as an anchorage to do the intrusion of the segments. A protocol that helps us effectively is a weekly change. And why weekly of the aligners? And why? Because that is a way to keep the intrusive pressure on the level of the lower teeth. And also in this case, where it does the main movement, which is to execute for the correction of this small occlusion. And finally, to generate a torque close to zero with the objective of helping this posterior support that helps us in the resolution of this frontal lower bite, deep bite. So we can see how everything was expressed, all of the movements and the solution of the case. We can see on the table the important torque on the level of the canines that gives me the option of opening the arch on the superior level to allow the lower levels, the lower teeth, to have the space to expand and allow for the bites to go up. Also, we see that in the upper teeth, we can see the bite ramps that were showing up as were necessary and which also had an overbite to be placed. This allowed me to de-articulate and also allow this speed curve to have a space on the premolar levels so that I can have a good leveling of the speed curve. And in the lower arch, we can see how this intrusion happens. So almost 3 millimeters on the level of the canine by canine. How can we then express all of this continuously with the expression of the power of these intrusives that are connected to the aligners with this change that was programmed in this particular case on a weekly basis. After 7 weeks, we do a scan of segments to check and also assess how this intrusion and this leveling of arch of the back zone. And we see that it's coming out perfectly in this moment. And furthermore, we can also start to identify the amount of intrusions that were executed in this instance on the level of the lower incisives. which are a little bit short about in the number 36. But what happened in this moment? Casually, here in Colombia, it was decreed the mandatory quarantine, saying that we're not allowed to see our clients until further notices. And with the end of, I mean, and without being able to go into the office, I had to give the aligners to the patients, but I told them that they would have to change the aligners every 10 days. One, that would increase the time of the aligners, because we didn't know exactly when we would go back to seeing our clients, because the situation was absolutely new to everyone. And also to give them some further time so that they could express themselves regarding this intrusion in the canine, taking into account that it is a 40-year-old patient, so that her metabolism and her response are different from an adolescent. With this objective, we started seeing patients again about the beginning of June. The patient comes back to our office. Then we see the records of the segment, and we find an excellent leveling of the lower arch, allowing for the speed curve alignment, and also this position here in this curve. In the analysis, we can see that it was also improved substantially the overbite, and we can also see in the scan that she improved her bite. And you remember that used to be approximately 80%, reaching an improvement of about 40% or 50%. So arriving to this, coming from this initial condition to this one, a better arch, an arch better developed, especially on the canine, and also with the better alignment of her teeth, and a significant correction of the overbite. And we see here in the projection of the over position and all of the amount that we were able to do with the intrusion that allowed for the correction of this deep bite. We also observe an improvement in the form of the arch in all of the positions. We also observe an improvement in the relationship in the class 2, and also a better back support. The overbite, the horizontal overbite and vertical overbite also had a decrease of 2 millimeters in overchat and 3 millimeters in overbite. It's important that I can also tell you that the cause of this change is commitment and discipline of the patient. A patient that is empowered with her treatment and sees the positive evolution of all her case motivated her to keep all of the recommendations to finally reach to these results. That to me is the most important of all, to have this smile, and instead of that hidden smile, now she has a full smile, full of colors, full of happiness, that has changed her completely, changed her face and the way she expresses herself. It's a patient that came to me with the fear of not knowing what to expect, and now she lives with a treatment that is absolutely successful, and that's for her more than satisfactory. All of this we achieved: the expansion, the leveling of the cross plan, the inclusion of the incisives with 14 aligners in half the time through the pandemic, 4.5 months of treatment, and with The first 7 alignments, we did the change every 7 days, and the next one every 10 days. And finally, this is the message. The most beautiful curve of a woman, her smile. So transforming this smile, this is why I put emphasis on my initial message. Transforming smiles and change lives. This is a way of expressing, of projecting in face of the life that you have ahead. And I opened something just to close about everything that was brought to me and how how Invisalign has influenced my life. This is my family, my husband and my 2 children, who are my constant support to reach and also to be able to do everything I do to empower myself and to have this power to go ahead in my office and to share my passion, which is education. I have the strength, truthfully, of being able to fight every day against all of the inconvenience to go ahead, keep on teaching and educating and projecting every one of my students and teaching them everything that this technique can be in their patients and in their lives of their patients. And furthermore, always there is a maximum that I share with you. The best teacher is the eternal student. In other words, I invite you to keep learning continuously because I learn every day with them. It has been a pleasure to me to share this short space of time with you and be able to share something of my experience. And now from Bogota, Colombia, we are going to Mexico because I have the honor of presenting to you Dr. Cecilia Vivanco, who is an amazing orthodontics. She has a very interesting case to share with us. Dr. Cecilia, the floor is yours. Wow, amazing. Thank you very much. Amazing presentation. I'm also going to share my screen. So everything is fine? Yes. Yes. Fantastic. All right. So first of all, thank you very much, Vicky, for this amazing presentation and also for the case. Well, I am going to share with you a case also of a woman, and I would like to give you a little bit of of a story of how Invisalign changed my life, especially as we are on Women's Day. First, I would like to talk about myself and also what was my step to decide that my office be guided by Invisalign and why I learned this kind of technique. I come from the Intercontinental University in the city of Mexico, Mexico City, and I took 2 masters from Dr. Jimenez and Dr. Malagan, there who are Spanish. And well, I am also a speaker at Align National in Mexico. We also started, well, the speakers started by give training in addition to certifying shorter trainings as a way of continuous education. And this allowed us to learn a lot more about the system. And nowadays, the group of speakers has the certification. We become official certifier for Invisalign Latin America. I usually go 2 or 3 times every 6 months to many university, like a Latin American university in Washington, but I go as an invited professor and I give 2 or 3 lessons during the every 3 months. I also am part of Invisalign faculty, and I have my private practice in the city of Mexico with 2 offices, one in the north and one in the south. I've been practically about a year I've been to New York studying with a doctor. Well, I would like to talk a little bit about her because today is Women's Day. So it was last year. Her name is Ingrid Barrijas, and she is actually from Antico, but she lives in New York, and she was the coordinator or the dean of the University of Rochester for many years. And now she has a private practice with two offices, one in Brooklyn, one in Manhattan, in New York. And she practically her clinical practice is Invisalign. I wouldn't say if it is 100% or 98%. She was the one who my father, my dear late father, was the one who introduced me to Invisalign practically when it came to Mexico. And I really loved the techniques. So I started to work with the doctor, and she was the one who introduced me a lot more to working treatment plans with aligners. She really trusted the system. I saw in her office amazing cases that were very well resolved with Invisalign, and she really used to motivate me to have a technique that worked much better than any other, which is the use of brackets. But brackets, she spent a long time being the post grade post graduation coordinator for Rockets. She was really smart. She was a genius. They knew the literature by heart, and she was such uh, a well prepared person. And she introduced me to this technique. This is why I loved so much the aligners, and this is why I came back to Mexico with the idea that these aligners had to come to Mexico, and that it would change orthodontics, and that it would change all of the brackets. And this is basically how I revolutionized my treatments. So now we are going to talk about the case. I have a client with the reason for coming to my office. She said that she didn't like to smile, and every time she smiled, she used to cover her mouth. Every time she spoke and that she had to smile, she covered her mouth. That she never smiled in pictures because she didn't like her smile, and she didn't like because there was a lot of inclination in her teeth, and also part of the gum also used to show. Also, when I took the initial pictures, we can see a lot of flotation here. Also, inclination on the side. Her telescopic bite that showed in a scanner on the right side. Also, a deep bite, and also a problem here. So, no bone pathology. I'm going to show to you now the treatment plan and how we planned to change the arches. And here we can see this support. I love to use them, especially in this kind of articulation, especially to open. They're very efficient to open bite. Now, let's see from the front how we open the anterior bite. Now, I am not a big fan. I mean, this is a personal issue, but I'm not very fan of Power Rich. But in some occasions, I use because sometimes when I have this kind of non-desired intrusion in this kind of crown, if I leave them, you can see the pressure points when you have this size of crowns. Now let's see the treatment plane. Well, the first treatment plan that we did was based on APR, or interpersonal erosion. I am not a very big fan of APR, so I try to replace this amount of erosion. So if allow me, if it is allowed, and if in the tomography is allowed in the cortical, then I do this kind of abrasion. Then I prefer to do that instead of doing this abrasion. Okay, so here we can see this deep bite. This is what I really like about the scanner that we have. We can have all this kind of vision. There is a deep bite. It's not telescopic, but also it's very clear. And also we can see the table of movement, and I like to see that there is a lingual inclination with the telescopic bite, and in the interior and inferior, but we can see some angulation, but nothing serious. Okay, in the sequence of movements, I really like to sequence the movements that are foreseeable, if it's possible to do simultaneously. So, for example, in this case specifically, if I was able to do the sequencing to do these aligners, then I'm not dividing all the movements, and it has to be perfect. So I can decross the bytes. There are some movements that are not good to sequence. Sorry, that is better to sequence than instead of doing simultaneously. But in this case of treatment, I prefer to do sequence of movement. If we analyze the Bolton, we can see that they are a little bit over the limits. 2.11 in the upper teeth, and the first working plan had a lot of APR, lower APR, because I have a lot of maxillar here, so I have to look at the working plan, and sometimes when it does not coincide what we need, then we always have to use the right tool. And so we have the final position that is absolutely correct. The middle lines are absolutely aligned. The holders are already placed. The client is absolutely aligned, and the bite was able to open itself. Now this is the final result. And the comparison of the beginning, this is what was foreseen in the clean check, and the final result, which is to be able to make a better comparison of midlines. These are the occlusal upper pictures, and also the comparison of the inferior teeth, the beginning, the what was foreseen, and the final result. Also on the sides. And now we are going to see the final scan already. Of course, there are some restorations in the back teeth, but we can see a good interconnection. The teeth are well aligned. We put some elastics to help in the telescopics, and also we open the interior bite. Well, part of what I wanted to share with you is that what really moved me to bet so much in Invisalign was this motivation. And I really love it, especially because my father brought it to me. Today, basically, I do not use brackets in my office anymore. And this has made my life a lot easier on a daily basis. I have a lot more time, free time. I am very much adequate to this way of working with Invisalign, and I'm so happy that the doctors who are here, if you have the opportunity, do it because it's a lot simpler and it's a lot more, it's a lot easier to work with Invisalign. So this is why I feel really honored for this invitation, and I would like to honor also Dr. Ingrid, and I'll talk a little bit about myself, part of my certifications that we provide in Invisalign and in the continuous trainings. So I basically have dedicated most of my life to Invisalign and conventional orthodontics. And as I said before, to me, it is a lot more interesting to work with this kind of aligners because of all the advantages that I have already mentioned. On the other hand, I would like to present to you Dr. Cielo, who's going to present to us an interdisciplinary case. I'm going to tell you a little bit about what I know of her. She is also a speaker at with Invisalign. She has been a doctor with Invisalign since 2009 and with as a diamond since 2020. She also has been a speaker in the city of Madrid, and she's also the coordinator of postgrad in the university. So I present to you Dr. Cielo, and I don't know if she can hear me. If she can please connect. Hello, Cecile. Good afternoon. Hola, Cielo. Thank you for the amazing presentation. That was a beautiful case. Thank you, Cielo. Thank you for sharing your story and also how you started. And just like us, I mean, me and the doctor who's going to share this presentation with me, it's so beautiful when we're able to share our trajectory. So thank you very much. And I am going to continue with you now in this late afternoon on the International Women's Day. Like as my predecessor said, it's been a long time since this movement started with the working women in Denmark. And we who are here tonight, we're very much hardworking women, not only the speakers, but also all the women who are here tonight. So I'd like to share with you a case and also a little of my experience. Uh, Obviously, I hope that my life story can help you in any way. So I'm going to share my screen. we start to direct the treatment. It's a patient with a bracket trend, and of course it's 1 millimeter up to 1.6 millimeters in the upper teeth, and from zero point 0.6 to zero point 0.8 in the lower teeth. So we sought these objectives in this treatment, and we started to establish the order of the intervention. We took the registrations, and we saw that practically there is a lot of spaces, and we see also a discrepancy of the teeth, especially in the lower teeth. There is no pathology. And we also do our studies. The encephalometric studies, we observe that it's a class 2 patient. In the diagnosis, we can see that. We can see a patient with some bracket trends. Basically, everything was okay. We don't have any situation that calls our attention. We have 2 permeable areas. So this is the profile. And we decide to do our objectives and our interventions. The main objectives are really the alignment. Also, we wanted to close distribution of the spaces and also do a dental leveling, because the lateral teeth, they were not proportionate with the central teeth. So we are talking about 0.5 millimeters approximately that they had in terms of discrepancy in between one tooth and another. So that is a problem of a Bolton. So we need to close the spaces, and that was not an option. The lateral teeth were also too small. So our option was to do the distribution of teeth, leaving 0.5 difference of distal from 1.2 to 2.2. So keep the class 1. The class molar was okay, because we had a molar, so we had a rotation. Because if you look at the picture, the premolar, that in this case is 1.4, was completely in the wrong position. We can see rotated. We can see this rotation, which in fact is one of the situations that we find in this kind of treatment that we prescribed. So we could do the rehabilitation, and we suggested the intervention of the periodontics, because obviously the rotation would be the degrees of stability, and also the option of doing a fibrotomy. So it would have the intervention of the periodontics to do this fibrotomia. In our clean check, we're going to have a total of 29 aligners, which really are active. We only have 23 active, 26 active, and 3 for overcorrection. We could have used them and we could not have used them. The point of controlling them to do the point of 0.5 millimeters is what we needed at that point. We knew that the lower teeth would come to space. We knew that rotation was a little bit complicated. And so the control of the bite was what we needed to make the correction of the bite so that we could have a rehabilitation of the patient. So here we have the clean check. All right. We can see the 29 aligners here. At the end, you will be able to see that here we have 0.3 between each tooth, but with the aligners of overcorrection. Before the aligners of overcorrection, we can see 0.5 of millimeters of distance of 1.2 to 2.2. So if we wanted to close the spaces more, we need to use the aligners of overcorrection. So only if necessary, that would be the option. We did the clean check. And as we projected, here we can see that before 0.5, there we go. So we also have number 26, and we have the 0.5 of aligners. And if we decided to use them, then of course we would need to reduce the space. So this was really what we wanted for this treatment. In the aligner number 12, we had to mark in this scan the treatment was doing very well, but we can observe that in the progress assessment of our patient, we find all of the teeth. However, on the issue of 1.4, we can see that obviously the rotation is not distal. And this rotation is what at some point was calling attention. If I find this rotation, or if we can observe the attachments that we have in this correction, is a very large attachment. And this is due to the fact that the rotation is about 50 degrees. When we have optimized attachment that are for rotations like the ones that we see in the 1.4, but in the 1.4 that has a larger conventional attachment, and this attachment is for doing this rotation. So here, as we do this subposition in this aligner number 12, as you can observe in the attachment, I can see that you can see the shadows, and you can observe that the attachment is not where it should be. So we had levels of rotations that were not being expressed on this piece. One of the solutions in this treatment, obviously, and what I wanted was to scan again and to send these aligners to be made, or to put buttons. However, as you know, the patient does not allow, the patient does not allow that. We say that we are going to do everything possible to reach the objective. However, wearing buttons for her was not something stable. Firstly, because she said that she didn't care about the premolar, but the problem is the teeth closer to the front. So we decided to continue, knowing that the rotation of this premolar was very much backwards. So we continued, and finally, in the aligner number 26, this is the result that we have. The spaces were closed in the arcade, the lower arcade, and also in the upper teeth. Also, the position of the premolar is not the final one. We had an interconsultation just the same with the rehabilitator, because aesthetically, when the patient smiles, we could see the rotation of the premolar, in this case of 1.4. So to her finish the treatment and to finish the distribution of space, and we can observe that when she smiles, we could see the rotation. The rehabilitator said that he could not do the rehabilitation without the rotation of this molar. So we did the progress assessment to show the patient what was the movement that she needed and the movement that she had. And we explained the situation, and we decided then to use, in this case, the aligners of subcorrection. We used one aligner only to do the buttons and be able to help in the additional aligners. So afterwards of the use of approximately 2 weeks of the aligners, along with one additional week that we put the final aligner, so we did the rotation of this premolar, having obviously a better positioning. These are the last pictures that we put. This position obviously was a little bit more acceptable to the aligner, to the rehabilitator to continue with the rehabilitation. This is a picture of the beginning of her smile with the spaces and the rotation in the upper teeth as well as in the lower teeth. And this is the coordination with which we finished in the lower and in the upper teeth, along with the position of the teeth and the smile. Finally, we did the rehabilitation with Dr. Ruben Cardenas, who is here in Medinas. And obviously, we did a photo show in which we did an analysis and we do a design of the rehabilitation of this patient to be able to do a coordination and a closure. We take pictures. We do also, we use this plaster. And then finally, we do the prototypes of the teeth that are going to be restored. This is the picture, and then we can see how it changed from a reference guide to the rehabilitator, along with the placement guides. These are the guides that they used for the rehabilitation. Here we have the rehabilitation of our patient. They are made with resin, and we also have a comparison of the before and after. Really, as Dr. Victoria said, the curve of the smile is the most beautiful curve of a woman. And really what our patient was seeking was this. Of course, the objectives that she wanted, that she desired, could not have been done through immediate rehabilitation. So this is why we did this prior orthodontics, and also we did the fibrotomy treatment to be able to do the reinsertion of all the fibers and also have a retention, fixed retention, so that we could have all of the correct position or keep it in the longer time possible. I really like to use this fixed. I also like to use the Rivera. And because this patient didn't live in the city when the Vivera material came, we sent to her home. And this is why we didn't have an interconsultation. So this is one of those cases that the offices really welcome when there is a patient like that. And we see that when somebody says, I don't like my smile, I want to correct my smile, you see yourself way beyond your position, because when your client comes and they say, and we observe all of the physical and morphological features of our patients to reach the objectives. So the satisfaction that the patient has, in this case, this woman, over the results that were obtained, and when they share their emotion, this is what really fills our hearts. The fact that we know that we have helped this woman to change her life, to be able to get to something that she at some point had desired, because she didn't undergo any treatment because she didn't like or trust the brackets, but she desired to be able to use aligners, but she really wanted to do that with resin. So, as I was saying, when with my clients, I believe that I tell my clients as well, gratitude is very important. I'm very grateful for the moments that I am living and all of the best that I have done in my life. I believe that this attitude has to be present among all of us women. And I wanted to share a little bit of my story with Invisalign. This is the last time I tell you, I swear. But people asked me how I started with Invisalign. This is the picture of my certification. You can see the Invisalign boxes that are pretty old. When in these boxes, we used to send our cases. I know that these boxes denounce my age. I have been in this company for some time. And the truth is that this dream, because it is a dream, it is actually a conquest. And this dream started when I decided that I wanted to do something different for my clients. I wanted to do something different for my patients. Of course, in this moment, we come out from the university with a lot of preparation. We have Invisalign, and I took my first certification in the city of Melina, where my coordinator of post graduation saw the training with me, saw the certification. He's a great friend of mine, and the coordinator of my post grade also took this training with me. So I think that the root of this date, this is where a dream starts, a dream that is not easy to make come true, but that is possible to make come true. When you have a goal in mind, I believe that that is the most important thing. Never miss your goal. And you have also to be ready. We always have to be studying, seeking information and knowledge. Now, this is where we come to. This is around the year 2009, from 2009 to 2018, I believe, approximately, when we visited. We took a training in a city in Costa Rica. The doctor told me, "Oh, it's a training, blah blah blah," and I never thought that this day would come, that I would come to this place, but it finally happened. And to me, this was really one transformation. To me, this was a change of the chip that we did, changing from um analogical to digital orthodontics, which is what we do now. And this would be impossible to be done without my working team, my doctors that come with me, Doctors Antonio and all of my assistants, Dr. Miguel. I think that without them, with me, nothing of what I have accomplished I would have accomplished. But in addition to my working team, we also have something very important. We as women, the fact that we uh, have to live our lives, and also we need to have a reason to live, something that goes beyond ourselves, which is our families. And this is very important because we are not just women, we're also wives, we are daughters, and we are mothers. So up to a certain point, the the gratitude of being a woman has to be present in our lives. And something that I would like to mention to you is you have to be surrounded by strong women, positive women, a positive group that helps you to move yourself upwards. Or we can also help other women to move forward so that they can accomplish their dreams. These are beautiful women, great examples to me. My mother, who studied and has studied all her life, I think that this is something that has forced me to move forward as well. So I invite you to surround yourself with great women and to be great women for other women so that we can help ourselves mutually. And there is one sentence that I would like to finish with. It's a quotation that mentions this. It says, some people want things to happen, other dreams about what will happen, and other make it happen. So we are not alone. I believe that all the women who are here are not alone. We are behind us. There is a woman, and we're all human beings that have. These are human beings that have interfered in our formation, and all of these women, they are the support that we need behind ourselves. And without any further ado, I would like to introduce you now to an amazing doctor, Dr. Gabriela Aparicio, that I have the honor of presenting to you. She is she has a diamond level and in the city of Uruguay. and she has been certified since the year 2010 as a doctor Invisalign. She's Invisalign faculty doctor, faculty speaker, and she has been invited to the event of the 350 best doctors in the world, a summit that takes place in different parts of the world, London, Spain. She has been present to those places, and she has an exclusive work with Invisalign since the year 2016. Thank you very much. It's an honor to introduce you, amazing woman. Doctor, can you hear me? Hi. Can you see my screen? Can you hear me? Perfect. Thank you, Dr. Cielo. Thank you for the presentation. Thank you for your case and also for sharing with us all of your clinical experience. And in the day of, on the Women's Day, in which we are celebrating women and we are bringing cases of women. So today I would like to share with you a case of a class 3. Okay. This client or patient, it's a female patient that has crossed bite and also a deviation of the lower level. I would like to show you this story because when this patient concluded the consultation, she had finished of receiving a diagnosis of cancer, a cancer that was very aggressive and a cancer that is very common to women. So my objectives were to, because of this, she had developed bruxism, and also because of aesthetics, but also to reduce the problems that she were having. She understood that the time had come that she changed her smile because she had had adolescent children. So she also wanted to change her smile, not only for the aesthetics, but also for the functional part. So I would like to share with you this initial picture. And now let's go directly to the case. So when I am sharing the radiography, you can see that her teeth are not well aligned. We can see that the upper teeth and the lower teeth are very obstructed and very far from standard. So she had orthodontics work, but there was 2 molars that we see that are in class 2. So what were our objectives? To improve the canine classes because her teeth are very much eroded because of how the bruxism she had. We need to decross her anterior bite, improve and highlight her anterior, improve her overbite, correct the torque, correct the line, and also correct the crowding that she had on the upper, in the inferior incisive, that was a little bit more complex. What I wanted with this patient is that it was a short treatment, an effective one, and that we didn't need to use additional aligners. So above all, I wanted the patient to have everything done fastly. How to decide about the resolution of the case? I decided for expansion of the upper and the inferior arch to improve the shape of the arches, a retraction and intrusion of the inferior incisive with the use of IPR to improve the OJ or OB, correction of the canine classes through the use of IPR, correction of the midline, correction of the incisive torque of the superior and inferior teeth, distalization of quadrant 4, that would make an increase of a molar 3, and also use of through class 3 elastics in the lower, from the lower canines to the upper molars, with the use of 16 hours a day to help us with the retraction of the inferior, and with the change of aligners, in this case for 10 days, and also a contention with Vivera. This case was a case of 23. Sorry if I'm having problem with my mouse. But anyway, this was a case of 23 aligners. And here we can see the aligners. We can see the frontal clean check. And what do we see here? We see here that we have mandibular excess on the canine level. Therefore, in the resolution of this class 3 that had this anterior problem, we could see a lot of APRs and IPRs, and we need to make a compensation. And this clean check, in the initial clean check, the number one clean check that is done in this case, we needed to work on the modifications later. So in one way or another, there were some other specifications that I'm going to show you later. And the movements are equally different. So this is the real thing, the frontal clean check and the correctors. I could use, but I decided to use. What do we see in the frontal teeth? We see the centering of the frontal of the midlines, a better form of biting, and we see if maybe we are able to reach one overbite. In this case, we have an overjet that was like number 1.9. Clinically, when I see the lateral, we see that the result was better, because we can't forget that both for the overbite as well as for the overjet, we start with the central levels. So in part because of the overjet, the same happens with the overbite. Part was open and part was crossed. I'm sorry, but her audio is kind of failing. This is the previous clean check. What I was seeing, we were seeing that there was, we needed to make a movement, because this is where she had a bigger distancing. And what else can we observe in the lower clean check? In the lower clean check, when we moved in determination, we can see a roundening of the arches, and also because of bruxism, we can see that there was a charge level here in this sector with the contact with all of the teeth, and also because of the pressure. Here we can see in this picture that we had occlusal contact. When I take a picture, what I want is the bilateral contact. So we can see that there was no contact in this zone. One other thing is that also this, in this case, was very important, and I like the cases to be functional. So I wanted to have a prior contact like what they had, and what I needed was a contact with the canine so that we could create this canine pathway. And this is why we have this picture with the occlusal contacts. Here we have in details the quadrant 4 because there are some differences. And when we open the sequence of movements in this case, we see that during the first aligners, only the first faces of the molars move in the lower case, because this is where I had distancing in blocks. I needed to do a distalization in blocks so that I could move the canine and I could climb to the canine class. That was the most comfortable thing. And then from the aligner number 4, we see that up to number 4, everything was okay. And then from number 4, we started to make all the movements. Here we have a superimposition that I like to look when I look at this case. I stopped here at number 4, which is as you can see. And why number 4? To show that there is no movement in the other teeth and that these pieces moved. As you can see, this is where we did the detalization in blocks, and we started to work with Rivera, and we see that there was an intrusion of these molars. And what I was telling you, in the pre-molded case, I had the movement. So I am sorry that I'm not going through in details because I don't have much time. But anyway, one of the reasons why we decided to use this technology is because it is very much focused. So as for the arch of the arcade, we always look, and this is the initial position and the final position of the clean check and the picture, and we want the pictures to be exactly the same, and they did. So we have 20 aligners, and they were able to make all of the necessary corrections. If we look in the arch of the arcade, we can see that in the lower maxillar, there is an increase. There is a greater increase than the upper teeth. And why is that? Because the teeth reached a distal distancing. And why? Because in this case, we had the inferior aligners. So it didn't affect much of the upper teeth, but I'm going to show you why the upper teeth influenced the lower teeth in the next slide. So we did a Bolton, and that was the best way to compensate the lower teeth. Here, in the lateral clean check, we can observe the clean check of the left side of the patient. And here we have the initial picture, the final picture. As you will see, to have the best canine experience, this is what we want the patients to have. But what we can see is the lateral distancing. We can see that we have a positive overjet, a positive overbite, and we can also see the change of the anterior sector that we said. Also, we also have the lingual torque in one of the lateral sectors. And as you can see in the picture, even though it was a short treatment, it helped us to see the gingival transformation. This is the right side where we can see the same changes. This is a picture that is exactly the same, and we see the same that we see on the other side. We see the canine teeth, we see a correction of the canine class. The most important is not only for the correction, but also the canine bite. We see that there was a change in the overjet and the overbite, and there was also a change in the teeth as a whole. I apologize for going a little bit fast, but we don't have much time. Here, I would like to share with you a little bit of the upper teeth, the upper jaw. I had to, let's say, get an overjet and a positive overbite. Here, with the superimposition, we finally realized that the extraction of the central teeth came with this could reach up to 3 millimeters. But we did the maximum of this intrusion. And why is this so important? Because there was little intrusion. Also, this is the table of teeth movement on to see that we had teeth torque, and also it changed the interlingual torque that is expressed in the picture in the gingival retraction. This is a final image of the client, and we can see finally that everything was exactly as we had imagined. And we see the central line, we can see how the arch is opened up, and we can see how there was the decrossing of the bite. As for the upper occlusal, we don't have much to say, but we did the correction of the premolars. As we can see, there was also a rounding and also an aligning of the form of the arcades, as we can see also in this rotation. So in this case, what are the objectives to improve the teeth, decross the anterior bite, make the corrections, correct the torque, correct the upper teeth, and we realized that all of the objectives were fulfilled. While I don't have much time, but what we did to be able to decrease, if you look here, this generated a little bit diastema. So this is why we made this difference. Because that would avoid opening space in the molars. So this is the initial radiography. As you can see, there was a change, and we can see that clearly. We can see the correction, but we also see a correction of the torques. If we compare the initial and the final screens, we can see how the values of the angles, we can see they are much closer. And if we notice, then we can see the inclination or the post inclination, and therefore we can come closer to the form that allows us to give a more harmonic smile. Among other things, we can also see that this molar was in class 3, but at least with a better settlement, we can give it a more functional occlusion to the patient. So we have 20 aligners, 7 months of treatment. There was a comprehensive training. There was a comprehensive treatment. And the final is exactly, this took exactly 8 months of difference. It took 8 months to finish the whole treatment. So here, I was telling you before that clinically you cannot see, but yes, there was a lot of spaces. So in this case, this was published on a magazine and it has the barcode. So if you want to see it, just take a look. But what I would like to share with you is that here we have a patient 8 months before the picture. The patient, when she had received uh, how they smile, changed. You can see how her teeth were not beautiful before. So we now see her 8 months later with her teeth perfectly aligned and with a smile that to me aesthetically makes her look a lot more beautiful because she seems to be a lot happier. And I feel very proud of her and how we have finally helped her to be able to give the patient what she needs, which is not only a beautiful smiles, but also change her self-esteem. So, as everybody has to share um, about professional and personal life, as I was introduced by the doctor, I started my learning curve. Started my in the university, as you may have seen. I also had the learning curve in the year 2018. I had the honor of being invited to London to speak among the 300 best speakers of Invisalign, and I was there with 300 doctors. That was a reason of pride to me. I love what I do. I love to share. I am a speaker at Invisa, and in this learning curve since the year 2015, I have had the opportunity of being in all of the international arenas, in many different international arenas, such as in London and in Spain. Uh, what makes me a better doctor with as an Invisa doctor? We become a better Invisa doctor when we are able to have short consultations, which allows us to spend more time with our family. Because we have short time of consultation, we have more free time, and we can dedicate ourselves to that what really matters most. In addition to my passion for Invisalign, one of my passions is going to the beach, and I love to go to the beach. And with Invisalign, doesn't matter because in the free time that I have, I can do a clean check and I can just study a case. So this is why I say Invisalign is fantastic because with Invisalign I have a lot more free time, not only for me but also for my family. So now I think that I share with you my final slide, and I thank you very much for listening to my presentation. And now, if I'm not mistaken, we're going to have the Q&A, right? Yes, you're right, Dr. Gabriela. Thank you very much. Thank you very much, all the ladies. I thank you very much for your inspiring. You are amazing entrepreneurs. So with great objectives, and it has been really gratifying to see these practices. We have some clinical doubts, and we start with Dr. Vicky. Doctor, it's said, how many millimeters are necessary to you introduce only with the liners, and did you do any kind of correction of movement? Well, in regards to the intrusion, we need to take into account the amount of movement in that aspect of the forecastability that can allow us. I mean, the part or the zone of the teeth that we are going to change. If we talk about the teeth, there are some level. The level is the reference when we are talking about a level of intermediate complexity. All right. So what do I mean in this case? The movement was completely foreseeable. However, it wasn't pure, but there was a pro inclination of these incisives, which generates uh, a relation that allowed to express 100% what I had planned and what I needed. In some cases, when this amount of movement, because of a need of intrusion, overcoming these 3 millimeters, we're talking about movements with a level of complexity that requires a more thought about auxiliary mechanics. But in this case, in spite of the limitations, what I did was to be very much emphatic with the patient with the aligners with the objective of allowing to express these vertical strengths that allowed because they also are the bibands that help in the movement of intrusion in the PC movement. Furthermore, the indication of use after 7 weeks for, to allow to express themselves in a more, especially in this canine that was there. So this case, we didn't do hypercorrection, but there are other cases in which I take into account the hypercorrection about .8. But what we can tell you is that with this new protocol, we're going to have more expressions of intrusions to success. In a short time, we're going to be talking about how we deal with the case of intrusion. In the next explore of women, we're going to have another case for sure with G8. And doctor, and how has it impacted in your life to be an Invisalign doctor? How has this impacted your personal life? Well, I have 2 words: balance and transformation. Balance because I really love what I do, and when you are submerged, I think that many of you spent many hours in your office, but let's say that this digital transformation has given me tools so that I can balance. I can balance my work times, dedicate time to those that I love, which are my family and friends, or also dedicate to a hobby or something else that you are in love with. I can tell you that in this order, what it has generated, if Invisalign has generated a transformation, a constant learning that allows me to take a lot more advantage of my profession, as well as to have a lot of significant change. And also, I see that I share with a lot more acceptance because my patients are a lot more are happier because of the efficiency of the system, and also because all of these passions are shared in such a way. And I take advantage of these moments to tell you of an anecdote. As I have told you, I really like education and I'm also connected to the university, etc. But when you hear me talk about it, like Igor, who is my son, and he has become my number one influence. He already talks with all property about our system and even recommends. So I can say that he is a speaker in his heart of Invisalign. Wow, amazing, doctor. Congratulations. Dr. Ceci, just the same, how has Invisalign impacted your life, doctor? Thank you very much, Marina. Well, part of what I said has also impacted my professional life. I believe that what I've always said is that when I compare uh, traditional orthodontics with Invisalign, you can see that Invisalign has all of the advantages. It is easier, it is more aesthetics, and it's easier. And for us to do a digital working plan that is a lot more uh, thorough is much better. I believe that in every case, it has all the advantages using Invisalign instead of using other tools. So I believe that this is a win-win situation. I mean, we win because we have more time, and also the patient wins. Doctor has a question specifically about the case that you have presented. What can I do if I do more APR than the clean check requests or less APR? This question is repeats all the time in certifications. So, rule number one for APR is to have the meters to be able to generate space and also to be able to measure what you have in your clean check, that you are actually doing the amount that is requested in the clean check. So do not you do APR if you do not have the right meters. And if we do with a little less of the space than what is asked in the clean check, I keep on moving with the aligners. Maybe here I could come to a situation that uh, maybe if they ask for zero point 0.3 and I give 0.5, I continue with the treatment and the work plan is ready to close the spaces, what is going to happen is that this is going to generate an undesired movement or an undesired intrusion. The problem with that is that this movement is very complex. So do not move forward in this case if you do not have amount enough of APR. Another part of the question is what happens if you do it in excess. Well, the problem is not so serious, but if you insist and the clean check asks zero point 0.3, but you are doing zero point 0.5, then at the end of the treatment, I have a space zero point 0.2 that, as I said, could close. If it is programmed in the treatment to close spaces, then I would give the first second to finish closing the spaces, or probably I would have to scan to ask for additional scanner aligners and close those spaces. There is an important article in the JCO that talks exactly about this. I mean, that if we don't do the necessary amount of APR, this is what could happen. It talks and it says exactly that sometimes we do a little bit less APR than was it requested by the clean check. And as we put the meter, maybe we are introducing a lot, and between the meter, because it is be, because the fact is that I do not have enough space. So the meter has to come with a little affliction, but we should not do it. We should not do it by force. Well, thank you very much, doctor. Well, now let's hear Dr. Cielo and Dr. Gabi. Being entrepreneurs, because the office is a company, how Invisalign has helped you in designing strategies to increase your consultation, and what guides or tips could you give to doctors who are starting, who dream of having their own consultation or their own practice? Dr. Cielo, yes, you can go ahead. Well, I believe that the support that is given by Invisalign, in my experience through the years, has been very important. I can comment on one of the difference. We are going through a path seeking to learn and seeking to update. Of course, nowadays is a lot more accessible because of the globalization, etc. And the support that we have as a professional of Invisalign for the consultation, for the issues of seeking strategies, etc., for the growth of our office as well, it's very easy. They give you a hand, definitely. So to reach the dream of such a scale, I believe that the most important is the persistency. I have always mentioned that you need to keep a goal. If you have a goal, like the Dr. Gabi said, it's possible, but you need to have an objective. There will be different situations that you're going to face that could very easily make you lose heart. Maybe you think, oh, I'm not going to be able to do it. But I think that these are tests that show us the path of life to continue. I think that perseverance and not lose heart is the most important. Thank you very much, Dr. Cielo. And Dr. Gabi, what is your advice for those doctors who are here today dreaming of having a consultation or having a practice? Dr. Gabi, we can't hear you. You are in silence. We can see you and your beautiful smile, but we cannot hear. We haven't learned to read lips yet. Well, first of all, Invisalign supports us from the education standpoint, from the logistics standpoint, from many different points. It does help us. On the other hand, the most important thing that you have is the support. We need to know how to apply with our patient. We need to learn how to do it in the treatment. So since we can have this consultation that has no emergency, we don't have any emergencies. That if we can work with different kinds of interdisciplinary things, or if we can be in our office and teach them many of the things that they cannot solve, all of there are many things that allows us to be able to see more clients and to be present in this moment, and we're able to delegate other things, and that way carry out a better clean check to have a better clinical result, which and that is the truth. So I would like to send this message forward to my dear colleagues who are with us tonight. I do not hear you now. Oh, I'm sorry. Thank you very much, doctors. And I really hope to be with you someday so that I can learn so many new things and also have a balance in my life. That would be awesome. I would like to consider myself the best doctor of Invisalign for my vocation because it's always fun to be with Invisalign. Well, we have a clinical question now that asks, what advices would you give in a case that already had started a treatment, but I want to do orthodontics? Well, if the patient has caries, the problem of caries, I usually work with the provisions in the system, the protocols that do exist. I do not deactivate them so that obviously the predictability has to be high. When the patient has caries, I do not eliminate the patient. when the patient has caries, I tell the patient that the, I'm going to do the, put the attachments. But as for resins, we use transparent resin to avoid any kind of problem regarding the tone. And the truth is that transparent or translucent, so that we don't have any problem. We also use special integrators, and we also use substances to be able to help have a better adhesion, because to allow for a better adhesion. This helps us to, obviously, the attachments cannot be de-cemented, and we can also use some sort of special agent that can allow for a better material for the cementation. And when we have patients with caries or some sort of crown, maybe we would have to change some of the caries that have been modified, and that certainly there will be uh, change, and then there will be to be defined that they need to be uh, changed. We have a question to Dr. Gabriela. Is it mandatory the use of elastics in posterior and anterior corrections? What happens if the patient doesn't use the elastics? It's a great question. Uh, in this kind of corrections, depending on how the clean check has been done, if it was requested with or without elastic, what the elastic does is a reinforcement, and it helps us in the movement. It doesn't mean that it's going to make the correction, or just saying that we are reinforcing. So if the patient, another problem is that I don't know if the doctor is that if is asking about a sequential or a block process, because things vary. So I would say, but in general, I would like to make clear that the elastics are an anchorage reinforcement, and if the patient uses, there will be an improvement. So this is good. If the patient doesn't use, then we are going to have a problem, especially if the elastics are necessary. So sometimes it is worth it to talk to the patient before, when they're doing the clean check, and ask the patient if they're going to use the elastic for real. Otherwise, we have to create another exit. And sometimes the other exit is to tell the patient that otherwise I have to make some extractions, pull out a few teeth. So that's a good question. Elastic or extractions? Open question now, doctor. It says, doctors, the perception and evolution of the treatment have improved with iTero from the side of the patient? Let me see who asked the question. Or if somebody else, one of the four would like to answer. Yes, in my concept, substantially. iTero to me has become a tool, a communication tool that is amazing with my patients. It's a way of getting a better commitment with them. For example, when I have to bring tools such as the progress assessment, we can show the patient how their case is evolving. And also we can congratulate them. And or if you have any inconvenience, that is an opportunity, a golden opportunity to emphasize the importance of the commitment in the use of the aligners or any other equipment or any support extra that is required, such as the elastic, like the doctor just said, in certain corrections. To me, this is a number one tool of communication as well as prediction, because in order to visualize on the side of the patient how the treatment would be and check their involvement. Thank you, doctor. Well, here I have another question for any one of you. It says, we have a patient that has 14 aligners. In the aligners, for number 3, is programmed to be defeated and the movement is a little bit delayed. I've checked the IPR and it's not programmed, but the aligner does not fit this tooth perfectly. Should I finish until aligner 15 and then do the scan and ask for a refinement, or do in this alignment some sort of points with the clamps? Well, if it is a case of 14 aligners and you are number 14, if I understand you have 2 aligners to finish, depending on the amount, what I would say is that you have lost the tracking, the segment of the aligner with the movement of the canine, as far as I understand. So we have 2 options, and it depends on the reading that you have of the loss of movement. If there is an option of suspending and re-scanning to feel more comfortable when you do, when there is a big loss of tracking, that is an option. But if the loss is huge, then we could, like the Dr. Cielo did with her case, which generated some couple of movements with the bottoms to recover. These are options that we have, and the result, I mean, the 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 decision has to be made with consciousness, especially because of the number of of space that you have lost and movements that you have lost. Well, so far we have no more questions, so let me check. Let me check once again. No, we have no more further questions. So since we have no more further questions, I would like to ask you, ladies, if you would like to add anything else to so we can say goodbye. Doctors, I would like to thank you for sharing with us in such a special moment. Thank you, Marinelle. Thank you, Cielo. Thank you, all of the doctors. I also would like to thank the presence of all of the people who are here. I have no idea how many they are, but I know that there are many. So thank you very much. Thank you very much. Yes, there are people greeting you from all over the world. There are people from Mexico, Bogota, Culiacan, Monterrey, Uruguay. People are saying hello and wishing you a wonderful Ladies' Day. 1 second more, ladies. Go ahead. Yes. I would like to thank all of the Invisalign team for the invitation. Thank you, ma'am. Yes, I would like to thank for the invitation. Thank you for such an amazing team of doctors or orthodontists for sharing their life experience. This has been such an enriching event, not only for me, but also for all of us and especially the doctors. This project makes me very happy for being able to share and to support other women such as ourselves and to propel them to move on and to continue as a strength. As Vivi said, I believe that iTero is very important. And what happens to me is that the fact of going to the digital and being able to work from home, this was very important. In other words, in addition to in the beginning, I was a little bit resistant, but now that I understand this new digital mode, I felt the benefit because now I feel that it's a lot more practical. And I have shared with some of the webinars that I have given. Normally, I do the first part in iTero, and then the second part I do physically to express the diagnosis, but the great part is done via Zoom. It's very practical. In addition, we have mothers, fathers, children, everybody comes to the consultation. And sometimes you have brothers and uncles. So I think that this is a part that it's very beautiful and it's nice to be able to share with everyone. Thank you very much, doctor. Well, I would like to say goodbye, and I'm very grateful for having the opportunity to share with these amazing women and certainly an amazing audience. Also, to share all of this experience with which all I have learned with my colleagues, and also feel that we are managers and propel this transformation that has generated such positive things in our lives, not only personal, but also the professional life. The invitation is to everyone, of course, Thank you very much, doctors. The truth is, it's been a long path and a long fight. And the women who are here, we need to thank all of you and ourselves. But also, there is a long way to go. We need to work together to have a world that is more and more fair without any sort of prejudice and discrimination of gender or race or religion. So now I would like to thank you all for sharing your cases, practices, and also thank Invisalign, the team from in, Align Women that has made these events possible. Diana, Larna, Carla, Diana, Carla, I wish you all the best. And I wish you all ladies who are with us now feel inspired to keep on working to reach and overcome your objectives. And that all of you recognize and take advantage of the talent and potential that you have as women. We invite you to answer the question or to answer the survey with a QR code that will come after the video to honor women. Thank you for being with us. Thank you for being with us to learn with Invisalign. And I'll see you in the next Invisalign webinar or Invisalign events. Thank you, and I wish you a wonderful week.